Okay, there we go. Hey guys. Oh, my hair. It's probably because I had headphones on. Because I had to go to study skills. We love that. We're watching a documentary today.
We have been talking about molecular biology, and so yesterday we talked about carbs, protein, lipids, the cell processes in your body that help break down those foods into energy. We're going to watch a documentary today since everyone grew in their test scores. I decided to not make a reason. But I can change my mind since you guys so we're going to watch a documentary, and I tried to make it as interesting as possible. It has blown my mind, and it's blown all the classes in front of you. They're just, you just have to watch it. But we'll spend like 5 or so minutes at the end talking about what we watched, and if it's biased or not. It's the only way I can put it. So, yeah, we're going to watch it. Somebody kind of like
Okay. I like it. Do you like my lip balm?
Yeah.
From Simply Southern.
Did you print it out?
No, it was just there on the floor, so I picked it up. I really like my hair today. Like, it's like messy. But I don't know, I like it.
What the hell? Oh, this is on Netflix? It's an hour.
Good channel, yeah.
I was supposed to be like, what you say, but then I just missed
I'm literally gonna put cuss words and curve hand on the back of my phone.
Nobody.
Could you not do the channel?
Just leave the lights off. Just leave the lights off. Jesus Christ, my dude, turn them all off. My French grade only went up to a C. Oh my God.
I
We gonna be doing bookwork, I already see it.
Just shut up. Do the channel.
Do you remember the conversation we had after we talked about the average run?
Yes.
Yes,
I'm
ma'am.
And how you guys put in your questionnaire that you want to do more hands-on stuff?
No.
I said the only way we can do that is if we follow directions.
No, ma'am.
I guess I'm supposed to delete my YouTube app and re-download it.
With guarantee
They're
that
not
we
letting me
follow
upload videos.
Hold on, I'm gonna show you my outfit.
So do you think that that's good behavior
No, ma'am.
that warrants that you should be able to do the lab?
No.
No. Alright. You have to do it so you can't hear them call.
So cute. Oh my god, I should make a shirt that says do the channel now. But I'm already in for it. Just reacting to what the hell.
Hey, Joey, still investigating.
Period. Periodic table. I hate that kid that sits over there.
Worldwide, we need approximately 350 million people with diabetes. There's no question that we're in the midst of a diabetes epidemic. Right now, 1 in 3 Medicare dollars is spent in the care of people with diabetes. 1 in 10 total healthcare dollars is spent on people with diabetes. There's no question that this is a major problem.
What in particular is the correlation of the diet and diabetes?
I'm not going to get into that.
It's a diet.
Wait, he's not on there.
It was Lisbeth's boyfriend. Man, what do you think? This is my outfit.
My name's Kim. I'm a filmmaker from San Francisco and I'm a confessional. I'm a recovering hypochondriac. Like so many of us, I have a family history of diabetes, heart disease, and cancer. My dad had his first heart bypass at 49, second at age 50. My grandpa died young from diabetes complications, and both my other grandpa and grandma died of cancer. I was always paranoid that I would also get one of these diseases. Like any good hypochondriac, WebMD Symptoms Checker was essentially my browser's homepage. Even in my teens, I took Metamucil every day and a daily aspirin. I read all the latest self-diagnosis books. I ate every multivitamin I could get my hands on, and I was obsessed with bodily functions. I followed all the large health organizations' recommendations for preventing disease. I exercise regularly, don't smoke, don't drink, sleep, reduce stress, and grew up eating what I thought was a healthy life.
World Health Organization this morning classified processed meat such as bacon and sausage as carcinogenic, directly involved in causing cancer in humans.
Processed meat is clearly linked to an increase in cancer. Hot dogs or bacon could be just as dangerous as smoking cigarettes.
The World Health Organization had looked at over 800 studies from 10 different countries, finding a direct link to consuming processed meat and cancer. Just one serving of deli meats daily increases your risk of colorectal cancer by 18%. I had no idea that what we ate affected cancer rates, but I never felt like I had eaten until I realized that processed meat includes hot dogs, and pepperoni, cold cuts, and deli slices, basically everything I grew up eating. The World Health Organization classifies processed meat as a Group 1 carcinogen, the same group as cigarettes, asbestos, and plutonium, and classifies red meat as a Group 2 carcinogen. Was this like I had essentially been smoking my entire childhood? If processed meats are labeled the same as cigarettes, how is it even legal for kids to be eating this way? I thought this was new information, but many of these studies have been around for 50 years. I couldn't believe I'd been eating processed meats virtually my entire life and was just now finding out how dangerous they are. Why hadn't I been hearing about it from the American Cancer Society, the largest cancer group in the nation? When I went on their website, I was shocked to see that none of this information was featured on their homepage. But even more shocking, on their Eat Healthy page, they actually encouraged eating Group 1 carcinogenic foods like processed turkey and canned meats. This is after the World Health Organization reviewed over 800 studies definitively linking processed meat to cancer.
Thanks for calling your American Cancer Society. My name is Sam. I'm a cancer information specialist. How may I help you today?
Hi, I was calling because I was wondering why you all recommend people to eat processed meat on your website, which the World Health Organization has classified as a Group 1 carcinogen, which is in the same class as tobacco smoking, asbestos, and plutonium. This would be like a lung association having a how to roll your own cigarette section on their website. Kind of the same thing?
Well, let me just place you on a brief hold because,
He wasn't able to answer my questions and said someone would get back with me. I had always been concerned about cancer because both my grandma and grandpa died of cancer. I wondered if things would have been different had they known the link between diet and this terrible disease. In the U.S., 1 out of every 4 deaths is from cancer. Oh, sweet. American Cancer Society rep confirmed an interview this week. So we just went in for the interview with the American Cancer Society rep, and the security guard said there's no interview scheduled. So I went into my phone, and it turns out last night, after I told her that the interview is going to be about the correlation between diet and cancer, she said she could no longer do the interview. After repeated emails asking why she was declining my interview to simply talk about diet and cancer, she stopped responding altogether. Why would an American Cancer Society rep not want to talk about this? I was, however, able to connect with a growing movement of doctors who are willing to talk about the link between the standard American diet and disease. And it goes beyond just cancer. I took my old trusty van, Super Blue, once again out on the road.
2/3 of adults are now overweight or obese, and we have an epidemic cascade of debilitating disease that's overcoming the country. There's no way we can sustain the current style of care with the epidemic that we're creating with our diet and lifestyle choices.
The diabetes, the arthritis, the heart disease, the dementia, the obesity, the cancers are affecting about 70% of deaths. All the data is that those 70% of deaths and morbidity are largely lifestyle related and preventable.
Most kids by age 10
in the U.S. already have fatty streaks in their arteries, the first stage of atherosclerosis leading to heart attacks, strokes.
Here in American medicine, we operate from the disease model. We are in the business of treating sick people. We are not in the business of trying to prevent people from becoming sick.
When you look at chronic disease risk, all the things that we walk around worrying about, actually dietary choices trump smoking when it comes to those risks.
If I could deliver one message to the researchers who are looking for the cause of diabetes and the cause of clogged arteries and the cause of high blood pressure and the cause of obesity, I would tell them the answer is in 3 words. It's the food. It's what Americans are eating. Today, with 2/3 of Americans being overweight, clearly there's a food issue. In the next 25 years, 1 out of every 3 Americans will have diabetes.
My name is Michael Abdallah. I'm from Atlanta, Georgia. And unfortunately, I was diagnosed about 10 years ago with diabetes. And 8 years ago, I had 2 stents put in. I don't know where to go. I don't know what to do. You're just like out of options, and you don't know what to do. Taking medicine, you listen to this doctor, and the cardiologist says, take this, and the endocrinologist says, take that. Then your general practitioner doctor says, you don't know what's going on here. And it's a real challenging thing, and it's something that you don't want to get. You just don't want to get it.
Government and media almost exclusively blame lack of exercise and sugary foods as a cause of diabetes. But I wanted to talk with an actual expert on the role of diet and diabetes. I went to speak with premier physician, diabetes expert, and researcher, Dr. Neil Barnard. What role does sugar play in causing diabetes?
Drives me crazy. Diabetes is not and never was caused by eating a high carbohydrate diet, and it's not caused by eating sugar. The cause of diabetes is a diet that builds up the amount of fat into the blood. I'm talking about a typical meat-based, animal-based diet. You can look into the muscle cells of the human body, and you find that they're building up tiny particles of fat. It's causing insulin resistance. What that means is the sugar that is naturally from the foods that you're eating can't get into the cells where it belongs. It builds up in the blood, and that's diabetes.
I had never heard that meat was associated with causing diabetes. We had always been told that sugar and obesity caused it. Renowned weight loss bariatric surgeon Dr. Garth Davis, though, agreed.
Everyone thinks that you get diabetic because of carbs. We did a huge study, in that EPIC study, 500,000 people. Carbs consumption was inversely related to diabetes. In other words, the more carbs someone ate, the less diabetes they had.
But meat was strongly correlated. Get that aha moment. The starches, the carbs are good for you. They're not bad. This idea that carbs make you fat is utterly ridiculous. Carbs cannot make you fat in and of themselves. We have storage in our muscles and in our liver for carbs called glycogen. So when we eat carbs, we either store it or we burn it. Now, eat fat, that goes straight to your fat. Your body can't turn those carbs into fat unless you're really overdoing the calories. Obesity, it's a death sentence.
You're at much higher risk of getting cancer. You're almost certainly going to get diabetes. No one wants to fat shame, and we all want everybody to be comfortable with our bodies, but this movement to be comfortable with our bodies has made us comfortable with being sick, and that's a huge problem. I go into the hospital and I look around, people on dialysis, all these sick people, and just about everything. This is what people are eating. Here's the thing.
If I eat a sugary cookie, the sugar lures you in like the Trojan horse, but waiting inside that cookie is a huge load of butter or shortening, and that's what fattens you up, and that's what leads to the diabetes, the fatty food, not really so much the sugar.
It's not that sugar's good for you. There's no nutrients in it. It's excess calories. But when you eat sugar, you don't get inflammation. When you eat sugar, you're not getting plaques forming in your vessels. When you're eating sugar, your body's going to store most of it as glycogen or burn it as calories. And so this focus on sugar has taken all the focus off meat, dairy, eggs, pork, turkey, chicken.
People need to understand, if their child gets diabetes, you've just taken 19 years off their lifespan. We're talking life and death.
I realized there was so much more about diet and disease that I hadn't ever learned. It felt as if this information had been practically withheld. Processed meat causes cancer. Sugar doesn't cause diabetes. I had doubt about the claims these doctors were making, so I did some searching on my own. Harvard researchers looked at 9 prospective studies finding that just 1 serving of processed meat per day increased risk of developing diabetes by 51%. The link between eating meat and developing diabetes became undeniable. But when I went on the leading diabetes organization's website, the American Diabetes Association, not only did they not have this information front and center, they were featuring recipes for red and processed meat. And on their recipes for healthy living, they had bacon-wrapped shrimp. What the hell?
All right, send an email to American Diabetes Association, see if they'll get back to us.
As disruptive as diabetes is, it pales in comparison to heart
If you're
disease.
teaching
Over
people how to
17
be healthy,
million
why
people
would you
die
tell them how to
every
make
year
a
from
bacon wrap? You're still
cardiovascular
making
disease.
a big
It is
deal
the leading
out
cause
of
of
it
death
because
around
they
the
know what
world.
they're doing.
Nearly 1 out of every 3 people will die from this disease. The amount of people who die from cardiovascular disease is the equivalent of 4 jumbo jets crashing every single hour, every single day, every single year.
My name is Amy Bresnick, and I'm from Swampscott, Massachusetts, a little bit north of Boston. And I recently went to my doctor for asthma because I have a very hard time breathing. And while there, she did some blood work, and one of the tests was C-reactive protein, and on a scale there was a scale of 1 to 3, 1 being low for cardiac event, 3 being high for cardiac event. And my number was 10.82. That means I am on the road for a heart attack, and she said probably within the next 30 days.
30 days?
30 days, if I'm going the way I was going. I take this for my hypothermia, take this for pain, oxycodone for pain, and lorazepam for stress, cyclobenzapine for a muscle relaxer. Also take Topamax and Prozac, and I also use a CPAP machine to help me breathe. And my asthma has been so bad this past year, I use it during the day as well to get some air. I am tired when I wake up. I'm tired during the day. I take a nap. I'm still tired. I can't breathe. And I know I need to make a change for my health, or else I'm not going to be here for my family.
When we speak of heart disease, I would say the role of alcohol is pretty small. The role of sugar is very small too. Smoking is big. The good news is that most people have quit or never did smoke. The problem with animal-based diet is contribution to heart disease is huge and it is pervasive. All this expensive imaging, procedures, bypasses, medications, none of which
I keep telling
has one solitary
you're
single
gonna
thing to do
stop. You're gonna get lung cancer.
with the causation of the illness. So your diet was completely benign, foodborne illness that never had its causation.
I don't want him to die.
When we eat these kind of dead meat bacteria,
You turn around.
within minutes, get a burst of inflammation within your system, such that you basically paralyze your arteries, you get a stiffening in the arteries, their inability to relax normally in half. So it's not like decades down the road eating unhealthy, there'll be some damage. No, we're talking damage right then and there, within minutes of it going into our mouth.
Many people are given the diagnosis of Alzheimer's disease, when it's not true Alzheimer's at all. The vast majority of people suffer dementia due to their tiny blood vessels in their brain clogging up, and their nerve cells being shortchanged of oxygenated blood. And guess where that blood doesn't then comes from? Those little tiny arteries are clogging up from that steady stream of fat, cholesterol, etc.
It's really quite clear from the standpoint of cancer and the standpoint of cardiovascular disease that animal protein plays an enormous role.
Is chicken better? It's a question of whether you want to be shot or hung.
The flesh food that I would eliminate from the American diet would be poultry, would be turkey and chicken. A brilliant advertising campaign to convince people that, oh, it's healthier, it's healthier.
But it's good.
The source of sodium in the American diet for adults is chicken. Can be labeled all natural chicken, will be injected with the salt water and up to 800 milligrams of sodium.
Heterocycloamines are glucose carcinogens, and they can form in any kind of meat as it's heated, as it's cooked. But by far the biggest source is chicken. We sent researchers into fast food and family restaurants. Not
That's
only
good.
were
Stop
there
killing the
carcinogens
chicken.
in every single restaurant, we found them in every.
Basically, can we go?
If somebody brings their family in and they're buying a bucket of chicken, nobody tells them that there are carcinogens. If you're selling carcinogens to people, you've got to warn them that they're in there.
But the American Cancer Society encourages people to switch from red and processed meat to chicken. Why would the American Cancer Society tell people to switch from eating one carcinogenic food to another, when a Harvard University study showed that men with prostate cancer who eat large amounts of chicken increase their risk of the disease progressing 4 times?
The number one dietary source.
Basically, what I'm getting from this documentary is I just need to go vegetarian.
Chicken, grilled chicken, organic chicken,
Oh wait,
machismo,
is broccoli
but
gonna make me die too?
cholesterol per gram is red meat. So just on sheer volume, it's the number one source. Yeah, eggs being close by.
I'm not gonna
I never really thought about
I'm
eggs
not
much.
gonna stop,
I just
so
thought
I
of
guess
them
I'm
as a
gonna die.
standard part of a healthy diet. But then I found a study suggesting that eating just one egg a day could be as bad as smoking 5 cigarettes per day for life expectancy.
So I can't eat eggs no more?
Is the most concentrated form of saturated fat cholesterol. It is made from days of milk and eggs, and it's considered pure fat and cholesterol. And when we put that into our bloodstream, it coats our red blood cells. Our blood gets thicker and more viscous. It changes our hormone levels. It raises our cholesterol levels. There's nothing healthy about eating yogurt today.
But I thought cholesterol and saturated fat wasn't an issue anymore.
You know, these saturated fat studies that have come out trying to vindicate saturated fat is a campaign by the dairy.
Are we gonna get copyright?
Saturated fat is dairy, not meat. In 2008, the global dairy got together in a meeting and explicitly, their agenda was to neutralize the negative impact of milk fat by regulating agricultural fat. They do, they funded study.
The main study that started the whole saturated fat media craze was funded by the National Dairy Council. The egg industry similarly funds studies that confuse consumers by making claims that eggs don't negatively affect heart function. That is, only when compared to eating a McDonald's sausage McMuffin. So what they're really saying is that eating eggs is just as bad as eating a McMuffin.
When you eat foods like beef or steak or a processed meat, a hot dog, you're not just getting saturated fat. You're also getting other additional toxins that are in that food. There's heme iron, carcinogens, processing chemicals. This is all much more complicated than just looking at saturated fat.
You know, the strategy is not on making the parts distinct. The strategy is to just try to confuse the public.
Alright, so we didn't get to watch that.
Yeah, we're gonna bounce.
But it's on Netflix if you would like to watch it. If anybody else asks, it's not on Netflix. We didn't watch Netflix today.
That says bye.